Alright, so today we're going to be talking about catatonic schizophrenia. Alright, so first slide will be the overview of the disease. So, catatonic schizophrenia or catatonia is a rare subtype of schizophrenia where someone who has this condition would suffer from a severe mental disorder that is usually characterized by striking motor behavior. In a case like catatonic level, an individual will usually remain in a state of almost complete immobility. So, someone who is suffering from catatonia will literally um, not be able to even move a muscle, and they can stay in that position, in the same position, for a long period of time, which is really scary and dangerous. Next, we'll be talking about the origin of catatonic schizophrenia. So, catatonia was first discovered in the year of 1874, and it was classified as its own entity by a German psychiatrist named Dr. Karl Ludwig Kahlbaum. Moreover, catatonia is composed of multiple signs and symptoms that needs to be present in order to start the diagnosis. Next, we'll be talking about the prevalence of the disease. So, according to myclevelandclinic.org, the catatonia disease happens approximately around 0.5 to 2.1% of people around the world. And the number then rose to about 10% of people who are in need of mental health treatment. So it rose to about 10%. It also has been reported that 1 in 1,000 people in the United States has the disease, with slightly more men gets diagnosed with this condition. And so far, researchers have yet to find the correlations between the race and catatonia. So it might affect genders, but might not affect races. So yeah, or any race like in particular. Next will be the common symptoms of the disease. So some common symptoms within the disease is that an individual will experience things such as agitation, grimacing, catalepsy, mutism, and many more. And these symptoms typically appears when one's mental health is slowly being destroyed. And the body systems that are mostly being affected by the symptoms are the kidneys and the thyroid part of the body. Next will be the causes of the disease and diagnosis. So the main cause of the disease is still unknown, despite 150 years of study have been dedicated to find the core problem of catatonia. So it's been over a century, and researchers have yet to find the root cause of the disease itself. However, this condition is classified as familial disorder, or we call it genetics, as one of the big factors in this disease. And this disease can be diagnosed by usually starts with neurological examinations by testing one's reflexes and reactions, and other ways such as using what we call the Bush-Francis Catatonia Rating Scale in order to measure the severity of the case. Next will be the prognosis. So, according to BMC Psychiatry, the prolonged course of the catatonia features may lead to a life-threatening complication such as pneumonia, morbidity, and mortality. And the life expectancy of someone with this condition really depends on how soon the individual receives a treatment from a medical professional. So the sooner the better. Living with the disease. So people who suffer from this disorder often cannot take care of themselves, as they will remain in a state of almost complete immobility, just like what we talked about in the first slide earlier. Therefore, help from a trained medical professionals are needed in order to take care of the patients that are suffering from this mental health disorder. So, ongoing research and effective treatments. So there are many researchers and organizations that are involved in the study that cannot be named one by one because there are so many of them that are contributing to this study. However, the last treatment that is found to be effective by these researchers and organizations is called the electroconvulsive therapy, or we call it ECT. And as you guys can see here, this is the picture of someone was doing an electroconvulsive therapy in order to treat his condition of catatonia. Last but not least would be the curability of the disease. So despite being a rare subtype of mental disorder, luckily this condition is very, very treatable and curable if treated sooner enough. So the treatment can be done through various ways, such as ECT, which we talked about earlier, the electroconvulsive therapy, or it can be done through a primary medications called benzodiazepines, which was proved to be effective. And according to study, between 60 to 90% of people who receive these medications have reported to be improved with their conditions of catatonia. And here are my works cited. Thank you for listening to my lecture.